As mental health concerns have risen over the past decade and reached new heights during the pandemic, there's a push for primary care doctors to provide mental health care. Research shows primary care physicians can treat patients with mild to moderate depression just as well as psychiatrists, which could help address the nationwide shortage of mental health providers. But the way many insurance plans cover mental health doesn't necessarily support integrating it with physical care. In-depth analysis now from Paul Seegert, managing partner at PCS Advisors, a health benefits consulting firm. Paul, set this up.
Well, before the COVID era that we're all in and still kind of in, 1 out of 10 people would report that they have anxiety or depression or some other mental health need. And once we got into the pandemic, that skyrocketed to 4 out of 10. And you can further break it down by age groups. 18 to 24-year-olds were the highest at 56%, 25 to 49 at almost 50%, 50 to 64, 39%, and the 65 plus at 29%. So there are other ways you can kind of slice that. Did you have job loss, other things? But suffice it to say, it went up significantly, and we haven't dealt with it very well.
Yeah. How is it confusing when it comes to mental health covered by health insurance?
Well, starting in the 1980s, health plans have always looked for ways to control costs. And one of the ways they can do that is to outsource certain functions. A lot of us don't realize that our health insurance companies are really third-party administration companies that insource and outsource lots of functions. Mental health can be part of that. So they can do a carve-out for that benefit. Many do. It's hard to know if that's going on or not until you go to use your benefits. But they may have carved that out to another vendor who then has its own unique network, which can create issues when you think you're going in network for care and find out that you didn't, and so on.
Boy, what's the answer for the patient here who just wants to get some help?
Yeah, a lot of folks want to go to their primary care doctor, and they'll go online and say, okay, this is my primary care doctor who's in network with my insurance company. Go there and get treated for a mental health need, and then that primary care doctor may bill the insurance company to find out, oh, it's in the carve-out and I'm not in network for that particular carve-out. Then the bill passes on to the individual. So really you need your provider to verify benefits prior to treatment. They need to reach out to the insurance company and confirm not only are they in network, but if there's a carve-out, are they in network for the carve-out?
Wow. We're speaking with Paul Seegert, managing partner with PCS Advisors. We're talking about why your health insurance may not pay for mental health care. Is that just nobody wants to pay? Is that part of this?
Well, yeah, I think that's really was the goal with the carve-outs, not to necessarily not pay, but to reduce the cost of the plans. So interpret that how you will. But yes, the goal was to control costs, and mental health as a portion of our overall spend is absolutely one of the fastest growing parts of what we're spending on healthcare. So I think it's coming to the forefront now, and this tradition of carving it out is not, I don't think it's working as well with the load of care that we're seeing today. You have a shortage. Less than 50% of people get treatment who need it for mental health issues. And there's a shortage of mental health providers that specialize in that. So we need to engage primary care doctors in helping with this, and many studies have shown that they're qualified and capable of doing that, and they can help fill that need. But we also have to be able to make it possible for them to bill for their services and not ask them to do it pro bono.
Wow. All right. So generally speaking, from what you're seeing or hearing, is the mental health problem worsening, or are we just being more open about seeking treatment? How would you characterize it?
Does, well, if you just look at it from a claims standpoint, claims are increasing, and it is more prevalent the younger the age group. So we can kind of theorize about the various factors. COVID clearly had a big impact. Lockdowns related to COVID and other measures that we took did increase mental health issues. And job loss, folks, younger people not attending school in person, all of these have been cited, and studies have supported the fact that those increased mental health issues. And trigger events like that in the past have shown themselves to persist. So the mental health effects lasted for years after the trigger event.
Thanks, Paul. Paul Seegert, managing partner at PCS Advisors.